Hello everyone. Today we'll be talking about thyroid disorders in children. Thyroid disorders are extremely common endocrine disorders seen in children, but if detected in time, they can be easily treated. Now, thyroid disorder hormone is essential in infancy for brain development, and later on in childhood, it is required for adequate growth, for pubertal progression and metabolic development. So, in children, thyroid disorders can either present at birth when it is called as congenital hypothyroidism. It is usually due to inadequate development of the thyroid gland itself or abnormalities in the enzymes which are required for thyroid hormone synthesis, but they are genetically determined. Usually these kids in infancy will present with prolonged jaundice, with a large tongue, constipation and an umbilical hernia. But before that, they are usually detected on a newborn screening test, which is mandatory as a universal screening throughout the world. In older children and adolescents, children usually of school-going age, thyroid disorders will present with growth faltering. It may present with menstrual irregularities in girls or delayed puberty in both boys and girls. They might also present with poor academic performance. So, in all such cases, early detection and treatment does lead to improvement in growth velocity and resumption of normal menstrual cycles in girls. Sometimes we have something called as a subclinical hypothyroidism, which can be seen in children. It is also a well-known entity in adults. Subclinical hypothyroidism is characterized by normal T4 and T3 levels and mildly elevated TSH levels. So, not all subclinical hypothyroidism needs treatment. Sometimes it could be temporary, secondary to a viral illness, secondary to weight gain or obesity, in which case it is likely to decline. Usually, it is diagnosed during undulated testing or while testing for obesity or while testing for associated illnesses like type 1 diabetes or autoimmune illnesses. So, the important point to notice here is that not all mild TSH elevations need treatment. It is important with that we do not over-treat TSH fluctuations. Of course, all such children need to be followed up once we make a decision not to treat, and if the disease is progressive, if the levels keep rising, we may consider giving treatment later on.